On the 28th of November, the IBTS will introduce a system to assess each donor's eligibility to donate on a person-by-person basis in relation to sexual history and risk. Previously, we have applied risks associated with specific populations which have excluded some potential donors. This system is called Individual Donor Risk Assessment and is similar to the FAIR system that was introduced in the UK Blood Services in 2021. It is more fair and more inclusive to use a donor's individual behaviors to determine if that person is eligible to give blood. This is done while maintaining the safety of the blood supply. Every donor will be asked the same questions about their sexual activity regardless of the donor's gender or sexual orientation or those of their partner. These changes incorporate the key recommendations made by the Social Behaviours Review Group in 2021. This group of experts was established to review the evidence base for donor eligibility in Ireland related to behaviours, including sexual behaviours that may increase the risk of acquiring specific blood-borne infections. The SBRG identified several factors associated with a higher risk of acquiring blood-borne infection. These factors include engaging in chemsex, having anal sex with a new partner or more than one partner, and having a recent sexually transmitted infection. Anal sex was identified as a higher risk activity than oral and vaginal sex, as the risk of transmitting HIV and other STIs is at least 5-fold higher. They recommended that the questions about these factors should be added to the donor questionnaire for all donors. We will continue to ask donors if they have ever had or been treated for syphilis or gonorrhea. If they have, they are not eligible to donate blood. We will also continue to ask donors whether over the past 4 months they have taken medication to prevent HIV infection, being diagnosed with a sexually transmitted infection, or had sex with someone who has a sexually transmitted infection, excluding genital herpes and genital warts. If the answer is yes, they will not be eligible to donate for 4 months. The changes will mean that some donors who are currently eligible to donate will have to wait for 4 months. For example, a donor who has anal sex with a new sexual partner will have to wait for 4 months before donating. This is because anal sex is a higher risk activity than oral or vaginal sex. However, other potential donors who are not eligible to donate at present will be able to do so. The changes will mean that men who have oral sex with other men but do not engage in anal sex will be eligible to donate without a deferral period subject to other eligibility criteria. The changes will also mean that gay, bisexual and other men who have sex with men who are in a long-term exclusive relationship will be eligible to donate blood even if they are having anal sex, as will their partners. These changes apply to all blood donors, regardless of their gender or sexual orientation. Therefore, some transgender donors who were previously ineligible to donate blood will be able to do so. Donors will no longer be asked gender-specific questions about their sexual activity. We have removed specific questions asking men if they have had oral or anal sex with other men in the past 4 months. We have also removed the question asking females if they have had sex in the past 4 months with a man who has ever had sex with another man. We have also removed the question asking donors if their partners have had sex in parts of the world where HIV is very common. Yes, it is working well. It is acceptable to donors and the blood collected is safe for patients. No cases of transfusion-transmitted infection have been reported to the UK Blood Services since similar individual risk assessments began. The IBTS constantly monitors rates of viral infections and syphilis in blood donors and any reported transfusion-transmitted infections in patients who have received blood. A study will be undertaken to determine if donors are complying with the new donor eligibility criteria.